All right, thank you, Dorothy. Well, we are taking your plastic surgery questions this morning for Dr. Stephen Davis, whose office is in Cherry Hill. Lots of questions, so we're going to move right through them.
Quick.
All right, well, our first question is from Cheryl. She wants to know, will getting a deviated septum repaired change the appearance of my face?
Okay, it really depends on the deviation itself. If it's a really crooked nose or a really deviated type of septum, fixing that will alter the appearance of the face. A lot of times, though, it's really a functional problem, and that deviated septum is causing trouble breathing.
Okay.
So fixing it doesn't really change the face that much.
So this is the ridge on the nose? Or if
it's actually the wall that comes down the middle of the nose.
Okay.
If it's twisted a little bit, it can create a little bit of an odd shape to the nose, and if you fix it, it can create a lot of differences.
All right, let's get to our second question. Take a listen.
Okay.
What would I do with abdominal fat? Can you move it around from the stomach to the butt? Around somewhere. Can you move it around anywhere?
I think a lot of people want to know that.
Yeah. You know, if there's anything good about abdominal fat, it's that you really can use it all over the body as a filler. So patients that want to have wrinkles or lines around their face filled, it's great. You can use it. If you want to put it in the butt to create a little bit more of a shape, you can use it there too, because what happens is fat that's difficult to get rid of is great to use as a filler because it won't go away. It retains its donor memory. So if we take it from the abdomen and put it in the face, it still thinks it's living on your abdomen.
Really?
Yeah, so that's one of the best things about having a little bit of abdominal fat. You liposuck it, put it where you want, and it's terrific.
I'll take it. You can use it wherever you want to. All right, let's get to our next question. This is a good one. Do you get a lot of teenagers wanting plastic surgery? What procedures do they want, and how young is too young?
Yeah. Your audience, your listeners really ask some difficult questions. This happens to be one of the most difficult subjects, and it is a very popular thing because families come in with their teenager, and I bet you're going to be surprised when I tell you that one of the #1 things is liposuction, but for boys.
Really?
The ages of 14 to 17, a lot of boys start developing female-type breasts, gynecomastia.
Yeah.
And the way to fix it is really by liposucking it, but they're kids still. So if they grow and they got a little older, would it just go away on its own because it's like baby fat? But by the same token, they're having some difficulty with the psychosocial aspect of things. They're in the gym or they're getting changed in a locker room and they're really very self-conscious.
We could do a whole segment on that one. It sounds
That's a big
like
deal.
All right, we'll have to go back to that one.
Okay.
That's interesting. All right, well, we have time for one more question.
Okay.
This is another good one. What do you think of the pills that supposedly help increase your bust size?
Okay, here's my experience with this. Over the years, a lot of patients have come in with telling me that they've tried pills or various creams to apply to their breasts. And the reason why they're there is for a breast augmentation with saline or silicone breast implants. So it doesn't really work. The thing is, I think those pills and creams could give a transient type of swelling.
Okay.
So it may give you the appearance that things are going to happen, but there's no way to really regulate it or to tell how big you're going to go. So I would say they really don't work.
We've had some good questions today.
Unbelievable.
Dr. Davis, thank you for coming in, and we'll go back to that other one because that's an interesting topic. All righty, Clayton, back to you.